first order of business is approval to let Kate and Phil be on the phone. Can I have a motion, please? Betty, second. Eden, all those in favor? Aye. Any nays? Okay, moving on. We'll have approval of the minutes from the November 30th, 2021 meeting. Can I have a motion, please? Jennifer and Rachel. Any questions, comments on the minutes? Okay, all those in favor? Aye. Any nays? Okay, moving on to informational
joined
items. Board of Health, Monica?
Hello, can you hear me?
Yeah, thank you.
In your packet is our most recent Board of Health meeting. One thing I will note that we did introduce our newest Board of Health member, Dr. Cadet. She is a family general medicine family practice for OSF, and so we welcome her to our board. As usual, the Board of Health, as the Health Department, are working through our COVID response, as well as we were recognized for reaccreditation as a national public health boards. And we are gearing up for our continued response in this year, as well as balancing our grants and our other service operations. More than happy to answer any questions.
Are there any questions for Monica? Steve? Oh, go ahead.
I just maybe ask Monica to give us a little bit of update on what's going on at the health department and some of the response programs, just so we're all aware.
Thank you. Appreciate that. Right now, I would define our current response as a little bit of a tsunami. Best laid intentions, I think, has created a little bit of this. And so we are now averaging about 350 new cases a day. And this is largely based on still the Delta variant. It's still our primary variant in Illinois, but we do see Omicron growing in consistency around our area. Likewise, between the holidays, travel, similar to what we saw last year. Again, it's just a rush of cases. What I think is concerning right now is our access to testing, the various types of testing, people being well informed of what type of testing and when they should test, as well as expectations. On December 28th, the state is in an effort to start moving towards what I would call our most difficult part of this response, is us moving into an endemic phase. They released a text messaging system, which allows individuals that test positive to be automatically messaged a phone number. The phone number, when you call it, gets routed to your local health department. So if you can imagine, 350 calls each day are coming to us from individuals that just received a text message. The system is supposed to have an additional support network, which is known as our surge center, to have it been also activated at the same time. However, there was questions from local health departments, including myself, as to what cases the surge would take and making sure that a flow of information was there. So the state delayed activating the surge center until next week, actually on the 13th. So right now, in this in-between time, locals are getting all of the cases versus we hope after the 13th, a large percentage will actually go automatically into the surge center, and the locals will be focused on our high-risk population. So those over 65, those in congregate living settings such as shelters, nursing homes, corrections, and then working closely with our schools for the younger age range as well. So that did happen on the 28th, and so our staff is responding as quickly as we can. Likewise, CDC announced on the 27th, night before we went live with this new system, changes in and guidance in isolation and quarantine. The state did adopt this. It is in effect for the general public. There are groups, though, that this is excluded from. The largest group would be our schools. So right now, schools do not apply to that. They still defer back to their general guidance that we've given them since the beginning of the year. So many of us who have school-age children most likely got letters from our schools, our superintendent saying, while we recognize there's an update to isolation and quarantine for the general population, that currently doesn't apply to our schools. Again, healthcare professionals like the health department are also on a different type of policy, and some of our essential and high-risk populations. So working through that nuances is also challenging with individuals that see something in the news and think that readily applies to them. So we are working through that. I will ask not only our board members here, but anyone that is viewing or other county team members, that the best way for individuals that are needing information about themselves as a case or needing a letter is to just call the 312-777-1999 phone number. Again, that's 312-777-1999. And the reason why is that is the state procured system. So even though it's a Chicago zip area code, I know that can confuse people, it still gets routed back to your local health department and it goes into our queue. People that try to call the health department directly will find that our messages are kind of off the charts right now. If they go through that 312, they actually are going to be put in the queue higher, because that is how we maintain the system, as well as if for some reason they were assigned to a different community or a different entity to follow up with, that's how they will be directed to the correct location. So between contact tracing and the changes, we are, kind of doing this transition. But we do have, again, glimpses of hope. We're notified, I guess the week I was on vacation technically, but we were notified that we're getting 3 vaccination assets from the state. This will help hopefully expand the health department's walk-in vaccine clinic. Instead of being Mondays through Fridays, actually Monday through Sunday. So we're going to be open 7 days a week, walk-ins only, all types of vaccines available. So really it should be super user-friendly to individuals. And then the other 2 assets we are going to be sharing with our hospital systems that are currently also at full capacity to alleviate some of their burden in their vaccine clinics as well. And then lastly, go out into the community. So it's a lot of approaches going up at once, and we just ask for the community to be patient with us.
Any other questions? Go ahead, Jennifer.
This is only slightly related, but having been fortunate enough not to have had a positive test in our household, are people being notified if they have which strand, the Delta or, which variation, when they get a positive test?
So when an individual gets tested positive, it is only for whether or not they have COVID. We then, as part of public health surveillance, what we do is we do random sampling, and those samples then go to a lab to actually get genomically sequenced to know which variant it is. Depending on where you got tested or which lab it works, it might show up in your medical record. Oftentimes it doesn't, because if you're going through like a state site, they try to make sure that it is medically secured, because it's only a public health surveillance tool. It's not a diagnostic tool. So they're kind of 2 different definitions from the FDA. So with that, you won't necessarily know what variant you have. But again, right now, there is a state dashboard that does show you the weekly changes in the types of variants over time. So you can see when we went from Alpha, Beta to Delta, and now you're seeing the Omicron start coming up with the samples that we've collected.
Thank you, Jennifer, for that. Any other questions? Okay. Do you have a report on care and treatment?
I do not have a report for care and treatment.
Okay. And then is Jason, I don't see Jason, do we have an EMA?
No, Jason's not here, but I do have his report. It is in the packet. I would just highlight that our biggest issue that we are having right now is some of our sirens are out, not out of service, but are either at decreased utilization, and that's partly because we are waiting for parts to come in. The largest one I would say is we did have one outside of Hannah City. If you look at the equipment status, that was struck by lightning. It is still something that we are trying to work through. Part of that is not only the actual equipment for that, but we are working with GIS to make sure that if we do bring it back online, does it need to be at the same level, or are there other sirens nearby that are covering that area? And so, again, very appreciative of our county GIS for supporting that work too.
Great, thank you. Any questions regarding that? No? Okay, moving on. Regional Office of Education.
Hi, everyone. Good afternoon. Starting on a real positive, we had graduation in December. We limited it to family members only, but you have 10 students that graduated from Peoria County high schools that wouldn't have if there wouldn't have been an alternative place for them to go. So we're very excited about that. Getting ready to start school back out at Wildlife here on Monday. Want to let you know that we're partnering with Easter Seals in their new Autism Collective. The Autism Collective is an exciting opportunity for any staff member, not just people that work with special education students, to take module-based professional learning online. And we'll give credit to those staff members that take that and give them their professional clock hours, and that flows through Easter Seals. We're gonna have a meeting there next month with all the regional superintendents in the area to push it out past Peoria County, so I wanted to let you know about that. I also want to let you know, I mean, mental health is obviously right now the cornerstone of this pandemic, right? And so you know all the work I've been doing in trauma. But in addition to that, we're seeing the escalation of the need for inpatient mental health for our youngest population. Over 500 of our local kids can't get a bed at Unity Point for the inpatient treatment. And so I'm going to be supporting them in a campaign. You're going to hear more about what Unity Place wants to do to build a more extensive campus. But if you didn't know, we provide the teacher there. We're their partner to provide a licensed teacher from the state of Illinois that works on that floor with the inpatient students so that they can continue their schoolwork while they are there for however long. And I didn't know if you knew that, so I wanted you to be aware. And they really love Dean. He's a great teacher. And last but not least, let's end with COVID. So many thanks to Monica. We were just joking before. We kicked off our back to school with Monica at 10 o'clock yesterday because things had changed, but they also haven't changed. So I'm sure you're aware that the CDC has recommended quarantine times be changed, but that is not true for your public schools. And so we had to work through that yesterday with our superintendents. That was really fun. And couple other things. Partnership with the health department. The clinic, because my workload was a little lighter with my schools out last week, I volunteered 2 afternoons in the vaccination clinic. And can I just say, that thing runs like clockwork. And the kids that were coming in and the families and the support of Spanish speakers that came in, and it was extraordinary. It was busy and I loved every minute of it. And so I was just honored to be a part of that. A couple other things I want to make you aware of. Peoria Public Schools, as you know, postponed going back to school until next week. So I've been getting a lot of questions. Well, why didn't they just go to remote learning? They can't. I want to make sure that that is very, very clear, that we were allowed to utilize remote learning at our discretion at the local level when we were under the governor's executive order. When that expired, the remote learning expired. They want students to be back to school in person with our safety and mitigation measures in place. So that is why Peoria chose, they couldn't go to remote learning, and they're going to start full school then on Monday. That is different than e-learning. E-learning is if there's a snow day and you can't go to school. Back in the olden days, you know, we would wait for it to scroll across the TV screen and then we'd be home for the day. Now they can take an e-learning day, but that has to be in conjunction with an emergency day or if the HVAC breaks down or whatever. So that is different. But Peoria made that decision to then, and they will make up those days because they are simply non-attendance days. So just in case you get asked about that, I wanted you to be really clear of what that's about. And also, if you would push out to your constituents, if you are in the Peoria Public School District boundaries, they're providing meals. It's easy to find. It is all on their social media. It is on their website, and you can push out the times and locations for that because it is happening all this week. And last but not least, to end on a real positive, I saw the one, the only GMB, the Gerald M. Brookhart, the lion of the regional superintendent, my predecessor. I saw him twice over the Christmas season, and he is just as ornery as ever, and I wanted to let everyone know that at his ripe old age of 85. All right. And when you're up at the microphone, could you please speak
because I should have had mine on.
Good afternoon. I just have a few updates in addition to the brief. One highlight is that the Household Hazardous Waste event that we are in partnership with the IEPA for the next 5 years, at least the next 5 years, was in the fall this year. It will move to the spring for next year, and we will remain in the spring, or we should remain in the spring, I should say. The main reason for that is to sort of spread out some of the collections with other nearby partners, like McLean County and Sangamon County. All of ours were in the fall, and somebody needed to move to the spring, so I chose to do that. The landfill budget was proposed November 18th, unanimously approved the December 15th meeting, and that budget is in your brief, and there's a resolution that we will get to, I suppose, next. And then the last highlight is that the Holiday Light Collection is going through tomorrow. Forest Park Nature Center partnered with us, as well as there are collection sites at a number of the county facilities, including the courthouse on the ground floor. And that is what I have for update this month.
Okay. Any questions for Becca? We are moving on then to the resolution. First one is FY 2022 Peoria City County Landfill Budget. Can I have a motion on the floor, please? Jennifer and Eden? Okay, are there any questions or comments? Becca, can you just give us a general overview?
So the proposed landfill budget is $480,350 in revenue, with $466,750 in expenses. Most of the expenses remained the same, and the line items will remain the same, with $76,000 to the city for staff support, $2,500 for the audit, and that is it remained about that this year as well. $8,500 to the county for staff support, and that's divided between administration, state's attorney's office, and sustainability office. There was a change, as reflected in the briefing, for the upgrades and maintenance of the gas containment system. There were some upgrades, as you might remember, some maintenance that was due at the end of the year, and it looks like that will continue into the spring. So a little more money was allocated there to $20,000 from $10,000.
Okay. Are there any questions? Steve?
Just clarity on the revenue reflects increased host fee of $2.68. Is that an increase of $2.68 from what? Kind of give me a little more detail around it, please.
Yeah, the 2021 rate was $2.61 per ton. And that does seem to go up each year slightly, and still reflecting the approximately 170,000 tons. 170,000 tons is expected.
Steve, do you have a follow-up? Okay. All right. Any other questions? Okay. All those in favor? Aye. Any nays? Okay, thank you. Moving on. We are at the resolution renovate or replace the health department and Gift Avenue complex policy decision. Can I get a motion on the floor, please? Brandy, second. Eden? Okay, Scott, you want to?
Sure, thanks, Madam Chairman. I'm going to walk through most of a slide deck that if you refresh your good reader on your iPads, committee members, it'll be preloaded. There's also paper copies available up here if you didn't grab one. Ellen from Farnsworth and Gabe from River City will also make some comments as well during the slide deck, and then we'll have some Q&A before you're able to call for the question. All right, let's see here. I'm going to stand since There we go. All right, so this is just the general project workflow for the entire project. You'll note that we're, in terms of policy decisions for the committee and the board, we're very early on. Today's decision is about renovate or replace. And there's going to be multiple policy decisions that'll be after this one today at future meetings. Estimated timeline. We are currently in phase 2, and the original schedule and timeline for today's decision was November, December of 21. This technically is your December committee meeting, even though we're having it in January, so we're pretty well aligned with where we are schedule-wise. Just to remind everyone in terms of what the components of phase 2 include. Again, the time frame was from September to February. We're obviously in the middle of it. Policymaker actions for you are the ones in orange. Today's decision is highlighted. It's number 2 of 5. The 5th one being a county board vote on renovate, replace, and then a separate county board vote at a later time on site decision. There's various management responsibilities and then responsibilities of the design team. Within phase 2, the discovery phase, we're actually a good chunk of the way through it, where we're at today. The last remaining step, which we'll talk about later, is the location analysis. So on to today's decision, which is renovate versus replace. This is a decision to either renovate or replace the physical plants or the buildings of the current health department and Gift Avenue. It is also to consolidate or not multiple county offices into a single campus. The policy decision before you today is not an evaluation of client and customer demographics, an expansion or contraction of services based on a campus, mobile, or hybrid delivery model, nor is it finalizing a location for where a campus might be. That recommendation that's in the agenda brief and the resolution is to replace both of those physical plants, i.e. the buildings at the health department and the Gift Avenue complex, with one facility, and it is also to consolidate multiple county offices into that single campus. Those offices include the health department, the coroner's office, the regional office of education, and the Department of Sustainability and Resource Conservation. We went through a 4-part assessment to reach that recommendation, and we did that assessment looking at the health department, the coroner, the regional office of education, the Sustainability and Resource Conservation Office, the County Election Commission, and also, even though it's not listed here, and I'll go into why in a moment, the Children's Advocacy Center division in the state's attorney's office. That 4-part assessment includes, first, customer services, or current services. So we, based on prior discussions at committee meetings, we cataloged and evaluated all the services that all those departments and offices currently deliver, and we put them into one of 3 categories. First being, is it a mandated service or not? And that would be a service that's either required by state law or by the Illinois Administrative Code. Second bucket is essential. Those are typically a grant-funded program, and once we have the grant, we are mandated to comply with the grant, but we don't have to take the grant in the first place. The decision point there is, in many cases, if we didn't take on that grant and then deliver that service, no one else is delivering that service. And then the third bucket is value added. So those are services that are either augmenting or extending one of the mandated services that we already deliver. And we did that across all those offices and departments. The second step was a needs assessment. So we looked at the building, both the health department and the Gift Avenue complex, based on the current state of our service delivery. And where those buildings, they need to be able to deliver our existing services before we can make any changes to the service delivery model. And we ask the question, can they do that, yes or no? And the question, as we walk through the next several slides, is going to be no. Third was a building assessment. So we took and did an analysis of the existing building's structural and mechanical systems. If you look at the report that was attached to the packet and provided after in a separate mailing after last month's meeting, you'll note that the gross area for both the health department and Gift Avenue may be equal to or oversized for the current service delivery model and potentially future service delivery models. However, the usable area or the operational area, which includes the service and administration of those operations, is undersized. And so how did we arrive at the fact that they're undersized? Well, Ellen and Gabe are going to talk a little bit more about that in their professional opinion and evaluation, but at a high level, when you look at the location of load-bearing walls within our buildings, you look at the placement of existing mechanical spaces and the number of mechanical spaces. If you look at specifically at the health department, we have in the main building on the main floor an actual change in elevation of a half story. And then at the coroner's office, obviously that was built as a detention center, so it has very different structural component. It leads us to the conclusion that renovation really is not fiscally responsible. Fourth and final component of the assessment is the construction cost summary. The team looked and analyzed the cost of renovating the health department as a starting point, plus in addition to accommodate any of the new or increased partnerships and co-location of multiple county offices that we've all been talking about for several committee meetings, and compared the renovation and an addition versus new construction. And looking at today's construction costs, it's only the cost of renovation plus an addition is slightly more than outright new construction. Right, now I'm going to turn it over to Ellen and Gabe. They're going to walk through some of their professional perspectives on that assessment and how they arrived at the recommendations that they made to staff and that staff is making to you. And then they'll turn it back over to me for a couple of other remarks.
Thanks, Scott. Good afternoon, everybody. So I am probably going to repeat a little bit of what Scott said, but it's also to serve as a reminder of the information presented to the packet that you all were given at the end of November. So number one, current services. We started out the packet by defining each of the organizations we were asked to look into, their purpose through their mission, vision, and values, and then as Scott mentioned, looked at and recognized their current services, categorized into mandated, essential, and value added. For the decision today to renovate versus replace, it is good to note that there was no substantial growth in the program size or scope because there is no additional funding in terms of flexible sources. So all the grants are predetermined, and so working with Monica, we had already established what the staff would be allowed based off the funding provided, so that then restricts the growth of those services. It's also good to note that there was no increase in partnerships as well, based on the current square footage of the building. Number two, as a needs assessment, so the design team met with each of the department leads and also staff at the health department to truly understand how they function today. What works, what doesn't, what would have to be renovated, to then give us a better understanding of cost, which Gabe will talk about in a little bit. Third was the building assessment. So again, he kind of alluded to this a little bit. We looked at the structural integrity. There are a lot of load-bearing masonry walls that are hard to reconfigure, or you can reconfigure them, but they're costly. We looked at HVAC systems, obviously in a health system and at a coroner's office. Odors, sounds, smells, all of that need to be taken into consideration. So we looked not only at heating and cooling, but also how the building functions for the need of what it's supposed to. We also looked at space configurations. So to elaborate more a little bit there, the coroner's office is currently oversized because it is a much larger square footprint than the coroner's office needs today. But all of the perimeter spaces are the juvenile cells, which is not really conducive to reconfiguration, again, because load-bearing masonry walls are hard to tear down and then build back up in a feasible manner. And that also means that all of the actual usable spaces for the coroner's office are internal with no natural light. When it comes to the health department, the square footage that we show for your current facility is very equal to the square footage that we think that you would need. Again, without the growth of any of the programs or services and without the growth of partnerships. So although it is equal in size, it doesn't really allow you to grow in the future or add any services to it, or including partnerships, which we deem not necessarily feasible. And then lastly, the construction cost summary, which Gabe will talk about.
Hello, thank you everybody. Gabe Rodriguez of the River City, just an honor to serve the county in this capacity and role. And huge kudos to Monica and Scott and their team and all they're doing to truly vet this process in the midst of global pandemic, nonetheless, along with all their other duties. So I just want to talk quickly about the basis of our pricing analysis. So it's similar to what Ellen and Scott shared. It was just an in-depth review of both facilities, the coroner's office as well as Peoria Health, or the health department, in terms of first the structure and how that could be possibly modified, change the building envelopes of the roof, the facade, the windows, the MEPF infrastructure, and then most importantly the lifespan of these facilities and their intended lifespan. And our analysis before even crunching numbers was that they're well past their intended lifespan. So and the other piece, we've done several warehouse renovations of the warehouse district, right? So historical significance where wide open spaces, structurally sound, historic tax credits available. Neither of these facilities represent anything of that nature. So our analysis was gut demolition for each facility, and so that's where these numbers come from in terms of re-roof, possible structural modifications to accommodate new HVAC units, new reconfigurations, perhaps a recladding, all new windows. So really keeping the bones more or less, modifying some of those bones, then adding to those bones as necessary. The other thing we did is we took a field trip and we saw a new coroner's office, I think was it Will County? Kane County, and then a new health department in Will County. So we saw these facilities in terms of they were specifically designed to function as they needed to function. So we had to take that into consideration as well. All of that, I think you can see the screen here, what we really came up with, and the market is fluctuating based on supply and demand and procurement. Also the recent tornadoes down south, so the numbers continue to change and we track those and monitor those closely. What we're seeing right now is the cost to renovate versus replace is going to be extremely close, within a couple percent. So one thing we wanted to highlight by this slide, and I apologize it's kind of small, is that even though they're close, renovate, replace, I think the end product is not the same. So again, a new state-of-the-art facility designed specifically to function as it's intended and as the coroner needs and as Monica and her staff needs, you're going to get apples and oranges for approximately the same cost. And the reason being is there are several factors. One is a complete gut. Secondly, there's added costs for demolition, which you wouldn't have in new construction. There's added costs for general conditions, so that's our project management and staff on site to manage a longer duration because of phased construction. We can't completely take Monica and her services all out at one time. There would be a multi-phase construction which would increase that duration. and increase that cost. Your MEPF will inherently be more expensive because you're gutting, capping, demoing, getting rid of what's there, and then bringing all new systems in. Not to mention the hazardous material abatement that is going to need to be taken care of as a part of that as well. So again, we think the cost is going to be close, but I think the end product of a new facility versus a renovated is going to be much better, is our take. So welcome any questions, or turn it over to Ellen. Okay.
I have a question. So is there a difference in future costs as far as maintenance, if we renovate versus replace?
I wouldn't think so, other than, if the structure or foundation, things we may not be able to touch, see, feel are compromised in an existing facility, there could be increased costs in the future should there be settlement issues or any structural deficiencies that we can't see or analyze. So I would think, and again, with an all-new structure building system, it's going to be more efficient. It's built per current codes and energy standards. So I would think the life cycle cost would be significantly less.
And one more question. On one of the slides, it says that the renovation plus addition would be slightly more than new construction. Does that new construction component include the demolition of the existing?
Correct.
Okay.
Yeah. Yes, sir.
I guess maybe to extend on the operating cost, did we take any consideration of the personnel operating cost? I know at one point we talked about having multiple entry points to the current facility, having multiple staffing that we could maybe consolidate, where ongoing we'd have potential reductions in operating costs, not facility costs, but operating costs that would come in to benefit a new construction versus renovate.
So at this point in time, this really was an analysis of the physical plant themselves. We acknowledge, as you said, Mr. Ricker, and we've anecdotally acknowledged that there is going to be operational savings, there is going to be personnel savings, with having a floor plan and a layout in a newly constructed facility that is going to create those savings versus having to work through and muddle through what the current floor plan looks like, even if it is modified through a renovation. We have not yet costed those out. That's in a next step, but we know that there are, for a fact, going to be savings. Monica anecdotally kind of has an idea of how many staff the size of her staff could be reduced, and how that might work with the other offices that we're looking to co-locate, but we've not put dollars to that yet.
Rob?
I noticed that the election commission was included in the assessment portion, but that assessment, I don't see the results of that assessment, and it's not included in the recommendations, so.
Correct. We did talk to the elections commission staff. We did. The team did tour the elections commission space. I'll turn it over to Ellen after sharing my thoughts as to why they are excluded from the recommendation. And from my perspective, two reasons why they're excluded from the recommendation. First, there's the space that they're in is better suited, both location and their layout for the services that they deliver, versus a potential future location taken in combination with the $700,000+ we've already invested in that space, even though we lease it today. And then secondly, while we have not had a discussion on site, we and location, we have started to put together a significant laundry list of potential sites and locations. At some point, a new campus just gets to be pretty unwieldy, and it significantly restricts the number of locations that we could potentially evaluate. Ellen, you want to add your perspective to why we did not include the Election Commission in the recommendation?
Yes, so we did tour that facility just like we've toured all the other facilities as well. So from an architecture and an engineering standpoint, that building is actually well suited for what it serves its purpose today. It's also a very nice facility with updated finishes and things like that. And so there's also room for expansion and growth. So there aren't really any compromises or deficiencies like we've listed with all the other facilities that the Election Commission falls under. So to spend money to relocate it and to build a new building of the same stature, it doesn't really seem wise, and therefore we did not recommend that that would change, and it would just stay the way it is today.
I guess I was never questioning whether or not that facility can work out of that facility. It's that we don't own that facility. We lease it. So if we put them in something that we own, to me that saves lease money, and we also don't have to maintain any other building. Like I don't see ever supporting us moving it and building a new facility or buying a new facility if we're going to have room that we could put them in. It's one less roof we have to keep repaired, or one less roof we have to replace every 10 years. So that's the reason. It had nothing to do with can they work in that space. So I'm a little disappointed that it wasn't included in the recommendation.
Scott, can you kind of give us an overview on that space, how long the lease is, and just a general high level?
Sure. So it is a lease space. I don't remember the square footage off the top of my head, but it is roughly, I would say, 2/3 of the building itself. As I said, we've got roughly $700 plus or minus $1,000 in renovations into the space that we occupy. We are in roughly year 3 or 4 of probably a 10-year lease. Obviously the lease costs are borne in the Election Commission budget versus somewhere else. And Mr. Renault's comment is well taken in that, yes, it is, there is the long-term cost of the lease, or if we own it, there's the long-term cost of maintaining that building. I think for us it was a function of looking at that consideration, and then also looking at whether it be the current property on Sheridan. I don't want to go down a rabbit hole right today about location, but any other potential locations that we're looking at, there's only so much footprint we have to work with, and if we add everything to the list, then we restrict ourselves in terms of which properties we might be able to actually effectively use and either develop or redevelop or renovate.
I still, with Rob on this, I think we should keep that in the back of our minds that this could be a possibility. If we decide on a space that this is something that we could do, Rob is pretty adamant about this, and I tend to agree with him that, this could be a possibility. So let's just kind of keep that in the equation as far as I'm concerned.
And absolutely. I mean, and should the committee and the board vote to support the recommendation, we absolutely can continue that conversation and that evaluation going forward.
Thank you. Any other questions? Eden?
So for the other things that are in the Gift Avenue complex, are there plans for those to stay there, or are those not in our purview?
Great question, Dr. Blair. It allowed me the segue to come back to that, since I mentioned that at the outset of the slide deck. So there are currently 2 other functions that are in the Gift Avenue complex other than the county coroner's office. The first being the Children's Advocacy Center division of the state's attorney's office. I've had roughly 3 or 4 conversations with State's Attorney Hoos. She has a long-term vision for the CAC that does not include either Gift Avenue nor a new HHS campus. Her vision for the CAC, which is largely grant funded, is looking to either partner with the Family Justice Center, which is another grant-driven county service that is provided by her office, the courts, and the sheriff's office jointly, and or partnering with Unity Place from a mental and behavioral health perspective. Her opinion is the synergies are more aligned with Unity Place than they would be with the health department, and I would tend to agree with that assessment. The third component of the Gift Avenue complex is the record storage that we have in the gymnasium. We already have a plan in place, but have yet to execute said plan to look at long-term off-site record storage that would be by a third party. That is a new operational expense that we'll have to incur. We're likely going to have to incur that no matter what we do with Gift Avenue, as record retention statutes in this state have not kept pace with technology, and we still have way more paper being generated than what technology would think you would need us to do, but it is just the fact of life, and we've been prepared to look at third-party offsite secure storage for about 1.5 years now, but have not had a need to execute that, and part of this process that will probably dictate executing that strategy.
Scott, can you kind of give us, we have records a lot of different places. Is that correct? I mean, we've got Headington Oaks, is there some in Hannah City?
We have records, yes, in a lot of different places. We have records in the bowels of this building that most of you have never seen, but if you ever want to, let me know. I'll give you a tour. We have records in the gymnasium at Gift Avenue. We have records in the basement of Headington Oaks. We have records at the jail and the JDC specific to those operations. We do have records in a building at the Hannah City Work Camp, and paper records scattered throughout various offices in this building. And the Election Commission has their records as well. So, and the Health Department has records also. So just about every single facility that we occupy has paper records. Many of them are on a destruction schedule pursuant to state law, and we're generally pretty good about following that schedule. It kind of varies from office to office. But there are some records that can never be destroyed.
So are those records like well maintained? Like if you wanted to look up something that happened 10 years ago, we would be able to find it?
Varies from office to office, i.e. the owner of that record. Some are very good in terms of how they are indexing. Obviously when a record goes from, say, a desk drawer or a file cabinet to a banker's box and on a shelf, it should be indexed so that you know what the box number is and what records are in that box. Some departments are very good at that. Some departments, less so.
All right. Any other questions? Well, we have Brian here. Hi, Brian. Yeah, I'll let you ask a question.
First of all, in the Peoria community, there's a lot of big empty buildings. Has there been any consideration on purchasing one of those? One board member 6 months ago, and I'm not sure why they didn't follow up on it, asked about the Sears building out there at the old mall. And I just wondered if there was any consideration of that, and or in the future, will there be any consideration? We don't know exactly what's going to happen with the Headington Oaks, but with, say for example, just throwing out a number, 50% of the Headington Oaks building, using that for our health department, because I do not support spending $22 million. And I know the money's supposed to be free, so to speak, but it's supposed to be used for COVID-related issues, like the challenges we're having in our police department and challenges other people are having in our communities. And I just think this spending $22 million on a new facility sends the wrong message to the constituents in Peoria County, during these difficult times. And so I think we should explore all options, including all the different buildings that are for sale or lease or whatever throughout the county.
So, Brian, that will be a future discussion.
Okay.
Today's discussion is only if we're going to renovate the current facility or replace the current facility. It's not saying where it's going to be. That is a future discussion
Okay.
that we're going to be talking about. So we're not even to that step yet.
Okay.
Okay.
Because I don't support necessarily renovating it because it's really not worthwhile, like you said. But I don't either support building a brand new state-of-the-art facility either. So I would like to look at other options.
Thank you, Steve.
I guess I'll throw a comment out. Be careful as we try to scope this. We talked about election commission and others, but we do have a budget we need to stay in. As we start adding more to the facility and then trying to put it in our budget, it'll probably throw us out of range. So while I understand and appreciate the election commission and some of the other facilities to look at, I'd also caution us, let's not build another Headington Oaks size facility that is not a reasonable use of funds.
Thank you, Steve, for your comment. Any other questions? Eden?
As I drive by this every day between work and home, I assume the answer to this is no, as it looks like a 60s brutalist structure, but is there anything of historical significance architecturally or anything else that we need to save?
No.
Is that building up to code?
No.
Okay. Okay, any other questions? No more questions? Okay, all those in favor of, taking the recommendation, which is to replace, say aye. Aye. Any nays?
Aye. Aye.
No nays, okay. Thank you.
Right. So, Madam Chair, before we move to committee action, let's maybe, since there was part of the discussion, let's talk a little bit for a moment about next steps.
Okay.
Next steps is the location analysis, and that's going to come in the form of two basic steps. The first step is a multi-part assessment to determine the building size that we're going to need. And we're going to assess and look at service levels, service delivery partners, service delivery methods, client and customer demographics, and then county demographics related to eligibility requirements for some of those services. Not all services are going to have eligibility requirements, but some do. And so we're going to look at those, look at all those components, assess them, and then use those to determine how big of a building do we actually need. Once we know how big a building we're going to need, then we can determine the ideal location based on those needs. And we'll look at, existing buildings that could be renovated. An example being the Sears building at Northwoods Mall, as Mr. Elsesser pointed out, or a greenfield, including land costs. So that could be everything from demolition and new construction on the Sheridan property or the Gift Avenue property, or it could be purchasing vacant land and building a new structure out of the ground. We'll also evaluate whether or not we should loan or lease. Obviously, there are existing properties that might be suitable for the new building, but we'll look at whether or not we should be owning those or leasing those. And then we'll also evaluate the cost of new construction versus renovating one of those existing buildings at an alternative location. So those are the next steps and the components of the next steps. And then we wanted to talk a little bit about feedback opportunities for the committee members in these next steps. And something that Chairwoman Williams and I have discussed with Monica on a couple of different occasions is using a model similar to what we did when we were talking about the closure of Headington Oaks, and that is to have some small group meetings. Under the Open Meetings Act, that's 3 of you at a time maximum. During January and February, having 2 or 3 meetings. The first 1 or 2 would be talking about service delivery and demographic analysis. The third meeting would be the site analysis component. We want to be data-driven and using GIS whenever we can. We're going to collate all of your feedback into the location recommendation, and then right now, subject to change, but right now we're targeting your February committee meeting for a recommendation on location. I don't know, Madam Chair, if there's anything you want to add to the process for feedback from the committee, or if I sufficiently covered it for you.
Yeah, we'll just, once we have all these small group meetings, we'll get back together as a committee and we will cover everything that was talked about in all those meetings. It's just really difficult to have 11 people talking about, the issue there. I mean, the meeting could be 2 or 3 hours long. So we thought the small group gives everybody an opportunity to get their questions answered. And, with Scott and the whole team there to answer those questions. So does anybody have any comments or questions about that?
I have a question, Kate.
Kate, go ahead.
I just wanted to ask, since we're looking at other facilities, is the Huntington Oaks facility being considered as one of those options?
As of today, we have roughly 24 locations that have the ability to be evaluated, and Headington Oaks is one of them.
I'm sorry, can you repeat that? You said it is one of them?
Yes, it is. Headington Oaks is on the list for consideration.
Okay, thank you.
Okay, any other questions? Great, okay, we'll move on. We're at committee action, review of executive session minutes. I need a motion to get that on the floor. Rachel, a second. Rob, okay.
Thank you, Madam Chairwoman. It's a recommendation of the State's Attorney's Office to continue to hold previously held minutes because the need for confidentiality still exists, and you can destroy the executive session audio recordings that are more than 2 years old, except for the ones that relate to pending litigation.
Okay. Any questions? All those in favor? Aye. Any nays? Okay, that's unanimous. Is there any miscellaneous today? Okay, we'll be adjourned. Thank you. Oh, wait a minute. Rob has something.
I just want to know if you have an update on the our ombudsman position.
We haven't. No. Do we, Scott? Do we have an update on that?
Shauna looks like she has something to say.
Yeah. Okay. Guess we do. Thank you, Rob.
I was in contact with the Center for Prevention of Abuse right before the holidays, and they were posting the position and going through the interview process, and said that once they had a candidate selected that they would let us know. So I have it to follow up with them here in a couple weeks. So they're working through it.
Thank you.
Thank you. Okay. Any others? Miscellaneous? Okay. We're adjourned. Thank you.